Hello again. My name is Dr. Shoar. I'm with Shoar Chiropractic and Acupuncture Medicine. We're located here in Oxnard, California. So today what I want to talk to you about is one of the questions that I'm asked a lot by many patients. And those who are non-patients, they ask me, what is chiropractic? What does it do? Why do I need to see a chiropractor? So briefly, hopefully I'll be able to explain to you what chiropractic philosophy it is. In my opinion, again, this is my opinion, what I have learned after practicing for 30 years of chiropractic. So that's what I'm going to talk to you about today. So very briefly, let's introduce you to what human spine is, what it does, and so on and so forth. Then I'm going to go over what chiropractic is about. Here's a human body. This is a hip bone. You got these vertebrae. You got about 24 of these stacked on top of each other. You have the disc. That creates a little space here where the spinal nerve comes out of your spinal column. Now those spinal nerves go to a different part of your body. Let me make something very clear. Any and every part of your body needs nervous system in order to function. Let me say it again. Any and every part of your body needs nervous system to function. Even that little muscle that's at the end of that hair that races when you get goosebumps. That nerve, that's the nerve that's making that possible for that nerve to stand up. So without your nervous system, basically your body will die. Give you an example so you get a better understanding. Diabetic neuropathy. Why is it that when somebody has diabetic neuropathy, and let's say if it's their foot, they develop gangrene, that part of the body dies. It's after the nerve that goes to that part of the body. When it dies, that part of the body dies. So as you can see, nervous system is what makes it possible for you to live. All tissues, including your muscle, your disc, your tendons, your ligament, your arteries, everything. The only part of your body that doesn't need your nervous system to function, guess which organ it is? It's your heart. But then your heart needs, the nervous system tells your heart beat faster or slower. Okay, but still needs nervous system in order to have it tell it how to be faster or slower. But in order for it to function, you don't need it to function without nervous system. That's why you can take your heart out, put it in a petri dish, it still beats. Okay, so having said that, now that's what the reason I tell you these, so you understand how important your nervous system is. Let's look at each nerve that comes out of your spine. Okay, it's called spinal nerve. There are three aspects to that bunch of nerve, those fibers coming out, okay? Those fibers have three aspects: the outer, mid, and the inner layer. The outermost layer, those fibers, nerve fibers, are the ones that go to your skin, that sense what? Sense pressure, touch, heat, cold. Those are that's what's called sensory nerves. So they communicate to your brain all the sensations. Somebody touches your hand. Okay, if there's something warm hits your hand or cold hits your hand, then you know that's what sensory nerve is. Now, if there's pressure on the nerve, on the spinal nerve, if the pressure is affecting the outer layer, meaning the sensory nerve, what do? You get tingling sensation, you get pain, you get numbing sensation. Does that make sense? And that's what that numbing sensation, tingling sensation is. That means there's pressure on there. Those sensory nerve. Now, if there is a pressure, let's say due to a disc herniation or due to anything else for that, it could be tumor for that matter, okay, that's pushing against the nerve. If the pressure is deeper, let's look at a disc, for example. If the pressure is deeper now, it's passing through the sensory nerve fibers. Now it is affecting your motor nerve. That's the next layer. That's the mid layer. Those are the ones that go to your muscles, that allows you to be mobile. That's why it's called motor nerve. It's motor. It makes you're able to move around. Those nerves are the mid fibers. If the pressure is deep enough that's affecting those nerves, guess what? Then your muscle gets weaker. Okay, so that's why we measure one side of the body compared to the other side, one arm compared to the other arm, or one leg compared to the other leg. So we can see, okay, there's the issue with the right side, the right side of your body, the nerve that goes to your thigh, to your quadricep, is affected. So the muscles are are not working properly, so the muscle, you get muscle atrophy. So there's pressure on the nerve, the motor nerve fibers, you get muscle atrophy. Now we've said that. Now, if the pressure is deep enough that it's affecting the autonomic nerve, those are the inner fibers. Those are the nerve that go to your, as the name indicates, autonomic. It goes to part of your body that you don't think about. It just automatically does it. For example, your kidney, your liver, your pancreas. You don't think about those. You eat, your stomach does its work, your pancreas does its work, your kidney and your liver, everything does their work without even thinking about it. They're automatic. That's why it's called autonomic. So autonomic nervous system, those are the nerves that are deep inside. Now, let me ask you this. If you have a pressure on the nerve fiber that's on the sensory, you feel pain, numbing sensation on the skin, shooting pain, you feel those. And if you have pressure on the motor nerve, then you start seeing, you develop a muscle atrophy of those muscles. But if the pressure on the autonomic nerve, what happens? You don't see any difference. You can't tell. You only can tell what? 10 years, 20 years later, you start developing kidney problem, liver problem, pancreatic problem. Those are the nerves that go to those organs. Those organs are not working properly, so you develop those later on in your life. That's by then, sometimes it's too late. So philosophy of chiropractic is about making sure that your nervous system is flowing freely, working properly, so not only you don't feel pain, you don't have muscle atrophy, but also you prevent those illnesses, those issues that you don't see them, you don't feel them, they're not visible, you don't sense them, but you develop in 5 years, 10 years, 15, 20 years later, those don't happen. That's basically the philosophy of what chiropractic is about. Hopefully I was able to explain myself as to what I think of what chiropractic is, why it is important to make sure that your nervous system is working properly. When I hear people say, I don't believe in chiropractic, it's like, what is it you don't believe in? You don't believe you have a nervous system? You have a nervous system. All chiropractic says, look, make sure your nervous system is working properly. Now, those nerves, because they go through all these 24 bones, if there's a bone out, if there's a muscle that's causing compression that's affecting, irritating your back, if this is due to stenosis, meaning the narrowing of this hole that's putting pressure on the nerve, or if it's due to facet syndrome, or if it's due to disc herniation, due to degenerative osteoarthritis, could be many, many reasons that cause the pressure on the nerve. And our job is to what? Is to find out what's causing it, do a proper diagnosis, and then proper treatment, which includes a whole array of different things. In my office, what I do, a whole bunch of different kind of physical therapy modalities, such as ultrasound diathermy, electromagnetic diathermy, electrical muscle stimulation, hydrochelator. We do manual and mechanical traction. We do manual traction, manual decompression. We do adjustment of the spine, and of course rehab exercises that allows you to strengthen certain muscles and stretch certain muscles. So there's a lot involved. And so as you can see, you need to go to a doctor who can properly diagnose you and making sure that you get the proper treatment. And so taking medication for a short time, I'm 100% for it. If you have a headache, if you have shoulder pain or back pain, for a short time, of course, you follow your medical doctor's direction for that. But then you need to seek doctor who can evaluate you, give you proper diagnosis and proper treatment so you can fix the problem. So hopefully I was able to explain myself, and thank you very much. Very quickly about our office, how to get a hold of us. How do you get a hold of us? We are located in Oxnard at the corner of Rose and Gonzalez Road, across from St. John's Hospital. We are in a shopping center, plenty of space for parking, and we do take all health insurances, including Anthem, Blue Cross Blue Shield, United, Medicare, Kaiser, of course, TriWest for those who are a veteran. And we love our veterans, and we absolutely give them red carpet in my office. So any and all veterans and law enforcement officers and firemen, and we absolutely give you guys red carpet. You're welcome in my office, and you all get a free consultation in my office. And that's not just sitting talking to 5 minutes. I'll do a proper examination, and I'll let you know what if we can do help you, or yes or no, and how we can help you. We can explain all that. Then you decide whether you're going to become a patient or not. Okay? Everyone have a wonderful day. Bye-bye.